What causes anxiety disorders? Well, like depression, there's lots of possible contributing factors. Stress building up over time. So the accumulation of stressful events can result in an anxiety disorder. Those patterns of negative thinking. Ruminating, for example, where you've got a thought in your mind, a negative, distressing thought, and you keep going over it and over it and over it. That negative thinking. Avoiding the situation that started the anxiety in the first place. So, for example, if you were thrown off a horse, and now you've got fear about being around horses, avoiding the horse, and avoiding horses in general, only helps perpetuate that fear. So we need to confront that fear and be able to get back on the horse again. Traumatic events can cause anxiety disorders. The term that you may have heard, post-traumatic stress disorder or PTSD, refers to anxiety that's related to the experience of a traumatic event. With what's going on in the world with hurricanes these days, that's an example of natural disasters that for some people can cause an anxiety problem like PTSD. And genetics. So again, having a genetic predisposition to anxiety also can precipitate having an anxiety disorder. Anxiety problems in people who have chronic pain fall into a number of different categories. Sometimes people experience kinesiophobia, or fear of movement or activity. With chronic pain, people may also have a fear of re-injuring themselves or further damaging tissues in the body, so they may do less activity. There may be a fear of pain, and that may be related to thinking that hurt is the same as harm, so that if I hurt somewhere, I must be harming myself. And we know with chronic pain that that's not always the case. Worry about the future, thinking the worst will happen. We call that catastrophizing, or making mountains out of molehills, when we think of something and we worry about it way beyond what we really need to worry about. And post-traumatic stress, as I've mentioned before, that can happen sometimes for people after things like a car accident, maybe an accident at work, or other physical trauma. And the next emotion to look at today is anger. And anger has a two-way relationship with pain. Pain can cause people to feel frustrated and angry, and anger, too, can make pain worse. So when we're angry, our bodies are tighter, they're more tense, and that can increase the experience of pain. What's really critical about anger is how we show it, how we use anger. Anger can be a really healthy emotion when we use it to solve problems, look at what's frustrating us and what we might do differently. But it can also be something that when we use it inappropriately, it can cause problems for us. And the example we have here is road rage. Anger can lead to negative thinking, where our thoughts just get focused on lots of negative problems. And as I've mentioned, it can increase stress and tension in the body. It's hard to have a relaxed body when we're feeling frustrated and angry. In fact, it's not possible. So when does normal anger become a problem? Because it is a normal emotion. It can become a problem for people when it involves things like harming other people through yelling or hitting, or when a person is harming animals or damaging property, when a person is harming themselves, or using the anger for power and control rather than using the anger collaboratively perhaps and thinking of it as a way of problem solving through frustrating situations. It can become a problem also when a person is angry a lot. So if a person would describe themselves as, yeah, I'm a pretty angry person most of the time, that's an indication that anger has become a very big part of their lives. They're often angry. And it can be problematic when anger results in negative consequences. So things like losing friends or family, injuries to yourself or to other people, when there's court orders, jail time, those are all indications that anger has gone beyond the normal expression of frustration and anger and has become problematic. So now that we've looked at depression, anxiety, and anger and defined them a little bit, we can look at some of the ways that we can deal with these emotions and options for treatment. Earlier today we talked about having a pain-centered life, and that's on the left-hand side of the screen. Today we're going to focus right now on how to move from a pain-centered life to function becoming the center of life and how to do that. So with chronic pain, starting with the pain-centered life on the left side, with some education, some pain analgesics, some medical treatment, and then as we go into the top of the circle, learning some coping skills, some self-management skills to help manage the pain. In doing that, activity levels can increase. Starting low, going slow, but activity levels can begin to increase, and as that happens, the body's physical ability can improve, so that strength, people become stronger, the muscles aren't as tight and tense, and then people feel more like going out, being with other people, engaging in social activities, which can have a positive impact on mood, feeling less depressed, happier. And when we feel happier, we've got more energy, more motivation to keep trying the self-management strategies, the new skills to manage pain better. So in looking at that downward spiral, it's important to not only treat the chronic pain, but also the negative feelings, so the depression, the anxiety, and the anger. And there's usually a couple of ways that are done to treat the emotions. And that's through medication and or psychological therapies. So it's usually these two avenues. Let's look first at the medications for the emotions. You can consult your family physician, who may refer you to a psychiatrist. If you're at the pain center, you can talk with your physician at the pain center if you think that you may have some of the symptoms of these emotions. And they may, either the physicians or the psychiatrist may prescribe some, say, antidepressant or anti-anxiety medications for you to start. And many times it may be necessary to try several different medications to find the best one that works for you. And that's because there's different classes of medications. For example, the antidepressants, because different neurotransmitters can be involved, dopamine or serotonin or norepinephrine. They may try different classes of antidepressants that will have the best fit for you in terms of their impact on the neurotransmitters. It's important to take the medications as prescribed, and not just when you're feeling down or anxious or angry. The medications work best when they're taken regularly, so they're in your body on a regular basis. And don't be discouraged if you don't notice changes right away. Depending on the type of medication, it can take weeks sometimes before you notice feeling better.